To let someone intimately in like that was not an easy thing, and it went very well with the hospice group of people. I am a native of Jeffersonville, Indiana. Lived here all my life. I left for a while. You know how we have to go away before we can come back and appreciate what we have. My mother, she's one of a kind. I can't even say enough good things about her. She was my biggest supporter. She was my biggest kick in the rear end. She was my everything. She was very healthy all her life. Around 95, there was notable symptoms of just being tired. We took her to the doctor and they diagnosed her with COPD. The word hospice was scary for me, so I didn't want to come to the reality of what that meant. But at the time, they said that it was a lot of hope for my mother because it would probably give her maybe a longer life and a better quality of life for her at the end of her life. They were there to help me, and that's what I needed.
Hospice today is not perceived as what it used to be. We're able to bring so many more services to patients and families. We use a holistic approach, team of board-certified doctors, nurse practitioners, nurses, certified nursing assistants, social work chaplain, and volunteers to not only treat the physical symptoms of the patient, but also the emotional and spiritual of the patient and the family.
It was amazing to be able to have my mother at home so that when I came home, our time together was just something that I could never have experienced that. If she'd have been in a nursing home, I guess maybe I could have went there, but it wouldn't have been the same. And that is the home that I grew up in. And that was a home that she lived her whole entire life. That's where she entertained. That was just where she wanted to be more than any place on the earth.
I first saw Minnie when she was in the hospital. We did a hospice consultation. I seen her at home later on after she had been admitted. We assessed her, ordered her some medications, asked how she was feeling, provided support and training to the caregivers, and got her more comfortable so she could have a better quality of life. I work for hospice because it brings so much education and services to family in a moment that they don't know is there.
They really listened to Mom. Christy empathized with her quite a bit. I know they were afraid that I was never going to be willing to do that final step when you just have to start making them comfortable. She sat down and talked with me about that, and she said, you know, are you ready? You know, and I said, I'm ready because Mom's ready. Sometimes when I look up into the clouds, I think of Mom because she always said she just wanted to fly away in the clouds. I guess that was my way of letting her know that I was okay with her passing. Whenever she got so sick, I told her to go ahead and fly away in the clouds. My mom lived almost a year, and I don't know how long that she would have lived if they had not stepped in. And she had a good life.
What our staff are able to do is to come in and help those families by taking some of that stress away and allowing them to be family members and reconnecting with their loved one as mom again or as dad again.
But when you stop and you think about moving a comprehensive campaign through a pandemic, and our donors, they didn't stop. They didn't stop. They kept the hammer down, and we kept delivering our services right through this.
I think we're getting more innovative with our approach and with our style, and we're thinking about all the ways that we can serve. I think you will see more palliative care being introduced to our community. You'll see more community-based support, such as grief counseling in some of our rural areas and our most urban areas.
There are a lot of things that we do that there isn't any funding for. And so even our grief counseling isn't really funded. There's no financial support baked into hospice reimbursement for that. And not everyone has a hospice benefit. So being able to provide support for people regardless of their ability to pay, being able to go into some areas where there's need, but payment systems aren't there yet. They haven't caught up. These are the things that our donors support our organization and allow us to do is to really expand and meet need regardless of what's going on with payment systems within healthcare. And we're so grateful for that.
So the campaign was a catalyst for us to be able to address some of the emerging community needs. Most recently, we recognized that our community is collectively grieving, and in order to support that grief, we wanted to meet the community where it stands. We recently launched efforts in the YMCA at the Republic Bank YMCA at 18th and Broadway, and are providing community-based support. We also have a partnership with Jefferson County Public Schools to support our students who have suffered death and loss and grief.
We set a $24 million goal, and we had several buckets that we were filling, buckets of need. And we celebrated milestones along the way. Every time we hit one of our buckets, it was great. However, $24 million, yeah, it was ambitious. We have the best development team in the country. These people are fabulous.
We had over 23,000 donors that supported our campaign. Many of those donors left us in their estates. They made planned gifts to us, but it was because of the individuals in our community that this campaign was so successful.
What we're doing, again, is not just healthcare. You're not just funding healthcare. You're funding something that's more holistic. It's the kind of care that I think we all hope that someday when we're in need, we'll receive. And today, your dollars and your support are not only helping those individuals who are in need today, but we're setting a future so that someday when we're in need and we need that support, this organization is going to be there. And I think that's something that we've all got to fight for.
What excites me most about Hospers Health is that we are going to provide a way for families to age in place in a comfortable environment with innovative care surrounded by people that they love.